The Laboratory System Strengthening Community of Practice, the LabCoP, brings together African countries to share best practices in laboratory system strengthening. Countries join through nomination from the Permanent Secretary of the Ministry of Health, nominating a team that includes laboratorians, clinicians, and the civil society. The LabCoP community it brings countries together to learn best practices so that countries do not reinvent interventions that already work, but try to learn best practices from counterpart countries to contextualize those interventions and shorten the time for interventions.
The partnership we have with ASLM is a collaborative one with clearly defined roles and responsibilities, and towards the common goal of strengthening the capacity and the capability of health laboratories in Ethiopia. We collaborate with specifically with ASLM. The first one is on biosafety and biosecurity and waste management. For instance, just recently we provided training to the health professionals in equipping them to manage the waste of viral load in the early infant diagnosis of HIV. It's the first in its kind, and ASLM in this training had provided us with the chemicals that are to be used for the waste management. In fact, we collaborate online and offline. We, share experiences from countries. ASLM creates learning opportunities online from experiences of African countries. There is a platform where we meet and learn from each other. We also collaborate on SLMTA and SLPTA schemes. We do also collaborate on ISO accreditation.
Our clinical chemistry laboratory is accredited since 2017. I'm the first trainee on the SLMTA program. Since that, our laboratory is achieving laboratory accreditations. So through accreditation, we managed to improve our customer satisfaction, decrease also the turnaround times and the stockouts.
If we have to talk the laboratory service, we have to know what we have and what we lack. We are working for the same goal. I think we are happy to hear that, and probably try to contribute our part if we are engaged, and that is very, very, very good news for me.
Our core is assessments, and assessments help us to identify those best practices and also to identify weaknesses where we develop interventions to address them. The LabNet assessment is one of such a tool, and it assesses the overall functionality of the laboratory network in response to meeting the goals of the UHC and also international health regulations. We also have viral load self-assessment that looks at the cascade of viral load services within the countries, but we also have other tools that assess integration of TB, HIV, and other essential diagnostics. And additionally, we have the WHO EID tool that also looks at provision of early infant diagnosis services.
C'est une formation de formateur. C'est ma première fois sur cette formation. J'ai eu l'occasion d'être formé à d'autres niveaux. Au niveau de, que ce soit l'assurance qualité, avec les sessions d'accréditation, j'ai fait ça. Mais pour moi ici, c'est beaucoup plus une ouverture, l'envergure est beaucoup plus grande. On a environ 9 rubriques. La rubrique politique, la rubrique des infrastructures, on a par exemple les contrôles de qualité, on a par exemple les biosécurité et biosécurité et biomédicale. Donc c'est une envergure beaucoup plus ouverte pour moi. Ça me donne l'opportunité d'apprendre et puis rentrer et aller former d'autres au niveau au niveau de centre et aussi au niveau de l'Afrique centrale.
In this journey, ASLM was with us, so we know at least where we are and we know where we're heading. So ASLM is giving us this and other supports as well.
If the land mapping project is working towards that, that is what we are looking for.